Good morning, 807, here on Mornings with Mark on Heartfelt Radio, and it's my pleasure to welcome to our microphones for the very first time Dr. Derek Cody from Crystal Clinic here in Akron. Doctor, welcome. Thanks for coming out.
Thanks, Mark, for having me. It's my pleasure to be here with you and your audience.
Now, this is an interesting thing for me because I have never had the opportunity to talk to a plastic surgeon before. And so I'm just very interested to find out how you do what you do. And I know some of what you have done, not only here but overseas, and we'll get into that in a few minutes, has been a blessing to a lot of people.
You know, plastic surgery for me is a blessing. I get to interact with patients every day who need some assistance, and being able to provide that assistance through so many ways that we can help patients. Patients who need reconstruction for skin cancers or breast cancer, or kids who are born with congenital defects. We can affect the lives of so many patients in so many positive ways. It's really gratifying for me.
Take me back to the beginning, because you grew up here in Northeast Ohio, right?
Yeah, I grew up in Cleveland, and I went to Ohio Wesleyan for my undergraduate education.
Oh, okay.
Ohio State for medical school. I stayed in Akron for plastic surgery training. And then I took a little travel to New York for additional training in microvascular surgery that allows me to do some really complex operations that help patients in specific situations. I spent some time out in California before returning to the area to be a part of the Crystal Clinic Plastic Surgeons team.
Now, you make it sound like, oh, yeah, I just did all that. But this takes time. Your specialty takes quite a bit of time to prepare for, doesn't it?
It does. You're right. It takes quite a bit of time. So medical school is typically 4 years.
Right.
Then plastic surgery training can last anywhere from 6 years to 9 years of additional training. So this is how we make sure we're ready to take care of patients who need us and do it well.
Okay, you mentioned a couple of the things that you are able to do and have become able to do thanks to a little bit of extra training. For people who think the idea of what you do is a little bit scary, tell them about the not so scary and the great blessings that come from it.
Yeah, so plastic surgery has a lot of different connotations. A lot of times we think of it as only cosmetic surgery, but it's really a lot of reconstructive surgery. And we train for so long to make sure we're really good at this. So patients should know that, you know, before you see a plastic surgeon, make sure they're board certified. Do your homework. Make sure they have the expertise that you need so that you can get the best outcome. We do a lot of different operations, which allows us to be both reconstructive surgeons as well as aesthetic surgeons. And again, we dedicate so much of our time to make sure we get it right, and patients deserve that. And so make sure when you see someone, do your homework, do your education, look them up, talk to them, and make sure that relationship is what it needs to be before you start.
Now, I think one of the things about the Crystal Clinic that kind of sets it apart in a number of ways is the part that you talked about last there. Talk to them. You have a system in place, and it's not just you, it's the orthopedic guys. I've talked to a couple of them on this program as well, where you are actually able as the patient to actually spend time talking to you as the plastic surgeon.
Absolutely. I think that's so important. And sometimes in medicine, we lose that as things get bigger and more complicated. But we're able to sit and learn who you are and what you need. And we don't have some of the additional external pressures. So I sit with my patients and we talk as long as we need to get the relationship established so that we can accomplish our goals. And so that makes me feel really good.
Obviously, your goal is medical, but your other goal is the comfort level, isn't it?
Absolutely. These are big cases. These are big surgeries. These are patients' lives, and it's important to get it right. And so you can't rush that.
Okay. We're talking with Dr. Derek Cody from Crystal Clinic here in Akron. Now, a lot of people may not know this, but you have a facility that you work out of in the Montrose area that is relatively new, and it's pretty cool, isn't it?
It is. So we have facilities really all over Northeast Ohio. I'm based in our Montrose area. We have our surgery center there where we have 10 ORs, and our inpatient hospital, which has 12 ORs. And then we have our office.
Really?
Buildings. Yeah, and it's the state-of-the-art, brand new facility. We love it, and the patients love it, and it allows us to really reach a lot of people.
You know, we're going to talk in just a few minutes about some of the stories that you have accumulated over the years, but I want to go back for a second to your education and some of the things you talked about.
Microvascular surgery.
Microvascular. That sounds incredibly difficult. And I know you had special training in that. I would imagine that not a lot of people in your specialty handle microvascular cases. Would that be correct?
That is absolutely correct.
Okay.
So this is a discipline of plastic surgery where we are able to restore areas that have been damaged. Sometimes the damage is from trauma. Sometimes the damage is from cancer, or sometimes these things can be congenital. And this allows me to move tissue from one part of the body to another and reestablish the blood supply. We do this under a microscope because these vessels are usually a few millimeters in diameter.
Oh.
And the sutures that we use to reconnect these blood vessels are thinner than a strand of human hair.
Oh, man. Now, I want to go back. I mean, I know there might be some people eating their breakfast right now, but moving tissue from one part of the body to the other?
Yes.
Tell me about that.
So that happens in a lot of different scenarios. Sometimes as plastic surgeons, we take care of hand injuries and hand injuries that have lost digits. We're able to kind of replace that digit and reestablish the blood supply if done in the proper amount of time by reconnecting these blood vessels so that tissue can get the blood supply it needs to survive. And so another scenario will be in the case of patients who require breast cancer. Once the breast has been removed, sometimes we can move tissue from the lower abdomen to restore that shape and form. And that's done by this microvascular technique called a deep flap surgery.
So basically, I guess, how am I going to frame this question? Basically, some of the things you're doing now in your practice, maybe 50 years ago, were kind of in the realm of science fiction?
Absolutely. So microvascular surgery really came of age, kind of like around 50 years ago. We're looking in the early 70s. People were starting to learn that we can handle blood vessels with care and reconnect them to help restore tissues. And a lot of plastic surgery really came out of some of the wars that we've had over the centuries, where we've had soldiers who needed reconstruction. And so we've been able to help them, and now we're able to help our citizens.
Let's talk a little bit about some of the stories you've accumulated over the years. You've been able to provide, and we were talking off the air, these stories, you said to me off the air, are stories that humble you. But tell me about maybe one particular patient who you were able to help where they may have thought there was no way.
So one of the things that I get to take care of as a plastic surgeon, specifically with microsurgery, sometimes we see patients who have paralysis of the face, usually from brain tumors. And once these tumors are treated, sometimes the surgery or sometimes the tumor itself can damage the nerves to the face. So these patients can't smile. And one of the things that I can do as a plastic surgeon is facial reanimation.
Oh, my goodness.
So a patient can come to me who has lost the ability to show emotion and smile, and that's so much of a part of what we do every single day. And to be able to help them restore animation to their face through some of these advanced surgeries is just really gratifying for me. And sometimes there are other physicians in the community who aren't aware that we do this too, and they're like, what's the plastic surgery going to do for you? Well, we can really do some advanced procedures where we can shift muscles in different places to restore the smile. And I even have another kid who was born with a condition called Mobius syndrome, and they can't smile through a congenital defect. And we can help them smile as well.
Okay. You mentioned already how humbled you are by what you get to do. I cannot imagine the feeling that must bring when some young boy, young girl with that particular syndrome smiles for the first time. I mean, what kind of an emotion goes through you at that moment?
So, that brings me to one of my patients from California who just wanted to smile for graduation. So we did this surgery on his left side first, and then we, a few months later, we went back and did the right side, and his biggest goal was to smile at graduation, and he was able to do that.
Amazing. Absolutely amazing. Dr. Cody, I saw in your bio, and I've made several trips to regions of the world where medical conditions are difficult for any doctor, let alone those who engage in specialties. But I know you've been to South America, you've been to Haiti, you've been to Africa. Tell me about some of those trips and what you've been able to do in some of those places.
So traveling for medicine is just an amazing thing for me as a physician because I learn so much. You know, when we travel, we think we're bringing our expertise, and we are.
Yeah.
But we learn so much more from going and seeing how things are done differently, seeing how things are done when you don't have as many resources. So the resources that they are able to gather and the ingenuity that they can kind of muster with less resources is just amazing. So
let me ask then, you are able to bring some resources with you when you travel.
Correct.
Okay. But you can't bring everything.
Absolutely.
All right. So,
absolutely. So we do take a large amount of resources and we share those resources and really we share our knowledge with the local community of physicians and nurses and healthcare providers so that they can continue this. But it's just amazing to see the strength and resilience of people who have less and will come from hundreds of miles away because they know when you're going to arrive. And they're so appreciative. And it's just one of the most humbling and gratifying things that we can do. A lot of countries don't. So in the United States, we have rights that protect a woman to have breast reconstruction. Most countries don't have any sort of guaranteed right for women to have any sort of reconstruction after breast cancer.
Really?
So we can go and we can do these surgeries for women who have really no means to acquire these procedures. We do a lot of hand surgery and burn reconstruction when we travel as well. I did some unique surgeries in Kenya where, we didn't have the modern anesthesia, so we had to really use our skills as physicians and surgeons to do local procedures and still make it something that's tolerable for the patients, not painful, and a good experience.
Dr. Cody, you mentioned how breast cancer surgery and reconstructive surgery overseas are so difficult. Here in the United States, this has become, I think, one of the biggest battles against cancer in the last 20 to 30 years. And you are playing a significant role in that here in Northeast Ohio. Tell me maybe some of the stories, a story of someone who thought, again, like I was mentioning before, there's just no way. And then you have the opportunity to interact with and work with them.
So our group, we really dedicated a large amount of our practice to caring for patients and families who've been diagnosed with breast cancer.
Okay.
And we really celebrate this every October because it's Breast Cancer Awareness Month, and we have our Pink Runway, which is a celebration of survivorship. Many of our patients choose to kind of model the Pink Runway for us and show how beautiful survivorship can be. I can think of several patients that really touch my heart. Really, they all do. I'll share one story. I had a patient who thought she was too old to have breast reconstruction. She had her breast cancer many years ago, had a bilateral or double mastectomy many years ago, and just kind of lived with it. And she finally came to see me, and she, once we were done, she had a beautiful breast reconstruction, and she said, "This is the best thing I've ever done. I wish I had done it 20 years ago, but doing it now makes me feel complete again. I feel whole again. I can go out and enjoy life without thinking about my double mastectomy constantly." So we get to touch people's lives. We have so many other lives and one of the things that we've really pioneered here in Akron is microsurgery for breast reconstruction. These procedures aren't offered in many locations in the country. And we now have patients traveling from far and wide to come here for these sort of really advanced forms of breast reconstruction.
And I know that Christian Healthcare Ministries has been a part of that in working with you folks at the Crystal Clinic.
And we're very excited about that relationship. We've been able to touch patients from all over the country, including Alaska.
Wow. Dr. Cody, I thank you for the time that you've shared with us this morning. And if people want to find you, whether it is in your specialty or in orthopedics or anything like that, crystalclinic.com is a great place to start, and you'll find what you're looking for, I'm sure.
Mark, this has been a pleasure talking with you and your audience this morning. And again, we look forward to helping our community.
Thanks, Doctor.
You're welcome.